Bien, bienvenue à Paris, Janina FISCHER. Écoutez, nous sommes, ma collègue Françoise Pascalin et moi, Bernard Maillère, les cofondateurs de l'Institut européen de thérapie somatopsychique. Et nous vous souhaitons la bienvenue à Paris, car bien sûr, nous organisons pour la première fois la formation SENSORIMOTOR PSYCHOTHERAPY, qui est bientôt, maintenant on pourrait dire, qui va rentrer dans sa 3e année. Et je vous laisse la parole. Bienvenue en France.
Merci. I want to thank IETSP for bringing sensorimotor psychotherapy to France. Any therapist who has worked with trauma is very aware of the difficulties in treatment, how certain symptoms and issues seem to continue no matter what technique we use. And those symptoms such as persistent anxiety, persistent depression and numbing, frozen fearful states, constant running, or harm to the body, threats to life, addictions. These are all symptoms that are driven by the body. They are not driven mentally and emotionally, they are driven from the body and the nervous system. And so the challenge in trauma treatment is how do we include the body in therapies that depend primarily on talking. I was so pleased myself to discover sensorimotor psychotherapy because sensorimotor psychotherapy allows us to work with the body with or without the use of touch, whatever is more useful and appropriate. And in sensorimotor, what we do is we study the story that the body is telling us. How is that anxiety continuing without stopping over years and years? Why does the body still feel unsafe? And as we listen to the story that the body is telling, we help the client also to listen to the story and to begin to intervene in ways that change patterns driven by the body. These techniques are particularly helpful because they can be used as a modality in and of themselves as a psychotherapeutic method, but they can also be combined with all other forms of therapy, cognitive behavioral, psychoanalytic, EMDR, and so on. We can use a little, we can use a lot. Sometimes the patient knows that we are working with the body, and sometimes the patient thinks we are just doing therapy. So we are very happy for this opportunity given to us by IETSP to be able to offer this very important psychotherapeutic method in France. If you wish to see further information about sensorimotor psychotherapy or to inquire about the trainings, you may go to the website of the Sensorimotor Psychotherapy Institute, founded and directed by Pat Ogden. The website is www.sensorimotor.org, and also be sure to check the IETSP website as well.